placebo control study. A total of 80 students of 18 to 24 years have been given, and those who consumed probiotic capsules showed a significant reduction in terms of the PSA scale, DAS scale, and STI scale. So we can see the perceived stress scale, depression, anxiety stress scale, and state anxiety inventory. This scores have been found significantly reduced after consuming probiotic capsule twice a daily, and it is a worth of trial for giving to our patients, and that could be one of the revolutionary brain biotic that can be a game changer for managing the host of condition, especially having the GI motility disorder associated with anxiety and depression. So I would recommend that it's a trial that we can just give to our patient, and there are other options. But I think that one of the restraints could be the cost of therapy, and I think the manufacturers will soon reduce the cost, but it is not too much so that we can recommend it. But the problem with us is the co-prescription of the other drugs can increase the cost of therapy. So otherwise, it's a very, very good drug, good molecule we should advocate to all of our patient, especially having the anxiety and depressive group of disorders. Next, please. So these are the references, and I'd like to give a trial of the probiotic food. Instead of choosing these 18 dishes on the left-hand side, we can simply give the capsule proglobin, which contains the 7 bacteria strain in appropriate and effective dosage. Thank you for your patience hearing. Sir, that is this trial has been done as all the trials being done with the comparator arm of the placebo. So for the generation of the FDA approval, we need a double-blind randomized placebo-controlled trial. But for the real efficacy scenario, we need a head-to-head trial with the prime drugs. So we need the trial with the prime comparator drug like SSRI or other group of drugs. That is required, and down the line, especially we know that some of the drugs like NASA group of drug, mirtazapine, it is also having the beneficial role for the GI symptoms. So certain vis-a-vis trial of the drugs are down the way. So it has got the approval, and we are using it. And we need more young researchers in our IPS forum who can do those researches, how this vis-a-vis drug trial can be done.
Like usually we know that when we use an SSRI, we expect that at least it will take 2 to 3 weeks before it starts functioning. So similarly, in this case, like, is there any time period before it starts functioning, before it starts showing any effect? Because in most of our patients, they want the result tomorrow. You start the medications, they want the result tomorrow. So what should we tell them when to sort of have an expected effect when we are using probiotics? That's my first question. And secondly, how long should we continue them?
Yeah. First, to answer very interesting and very clinically relevant question, Dada, and thanks for your word of appreciation. So coming to the first question, one study has been done here. I have shown the slide by Dr. Venkatraman et al. And his Venkatraman et al. Has shown that the probiotics are effective within 7 days. So first 7 days of treatment, we have seen the efficacy. But the problem is that we had these similar claims with other drugs like vilazodone. We have seen that vilazodone will be an effective antidepressant theoretically. If it is given within 7 days, we'll get the desirable report. But we are not getting the desired response within 7 days in a true sense. But we need to see. But the claim is that within 7 days, by Venkatraman et al., they have published this study. And that is effective within the within 7 days span. The second question about the how long. So for this question, we need certain parameters to be addressed, like safety, tolerability, efficacy. Now we have this trial for the approval. We know that FDA requires an approval for 6 to 8 weeks trial, at least 2 or 3 trials to be positive. So for that, it is getting approval. And as in this meta-analysis, I have shown that the most of the trials are being done.
Thank you so much.
Bifilac, and a question has been of a commercial product, Bifilac, how it is effective, somebody has asked. I would like to mention mostly it is the lactobacillus or Saccharomyces cerevisiae like group of things. It has not having this 7 bacteria effective studied component. Effective dosage has not been marketed elsewhere. So those are the, I can call them first generation drugs, first generation probiotics, and we are having this 3rd or 4th generation probiotics. So brain biotic revolutionary role I'll recommend and go with the keep changing part. So all the other change yielding place to the new, and Lord Tennyson said. So I'll always recommend to go for the more evidence-based product like proclaiming. I'd like to mention mostly it is the lactobacillus or Saccharomyces cerevisiae like group of things. It has not having this 7 bacteria effective studied component. Effective dosage has not been marketed elsewhere. So those are the I can call them first generation drugs, first generation probiotics, and we are having this third or fourth generation probiotics. So brain biotic revolutionary role. I'll recommend and go with the keep changing part. So all the other change yielding place to the new, and Lord Tennyson said. So I'll always recommend to go for the more evidence-based product like proclaiming.